In a similar fashion to our segmental rotation tests in side lying, we can perform the lumbar segmental rotation tests in both extension and flexion in a sitting position. The sitting position can give us some extra information. It may be important to us to understand how the segments move in a loaded or weight-bearing position. We'll ask the patient to sit on the corner of the table, 45 degrees. We want her hips at 70 degrees of flexion so it doesn't influence the position of the lumbar spine. And so that the patient's not too low for the therapist, we're going to, in this case, use a box under her feet to keep the position at a reasonably manageable height. We're going to ask the patient to put her arms across her chest, and then I'm going to grasp her rib cage below her scapula behind and below her axilla laterally. I want to make sure that I don't induce a side bending in the segments. We don't know how she couples, and therefore we don't want to impose a side bending. I am now, as in other tests in sitting, in extension, going to always rotate her away from me. And so I'm going to I'm going to start up at T10 on T11, and I'm going to put my thumb that I'm going to use to detect the motion on the caudal spinous process of the motion segment that I'm testing. So I'll place my thumb, in this case, on her right side of T11 because I'm going to be rotating her T10 to the left and want to feel the spinous process deviate to the right. I'm going to place my thumb there on the right side of T11. Before I begin the test, I'm going to feel for a step relationship between the two spinous processes. She may be a little bit asymmetrical in a neutral position. I want to be able to know that in the starting position. Then I'm going to rotate, first extend her into the segment, and then rotate her to her left, and first with the tip of my thumb, feel the spinous process of T10 deviate to the right. I will continue the rotation until I begin to feel rotation or deviation of the spinous process of T11 to the right. Then I know I'm at the end of the segment. I once again feel for the step and qualitatively compare it to the relationship before the rotation. That will give me a concept of how much she rotates in that segment. Then I can go to the next level. I will, in this position, extend her into the segment, avoiding side bending, rotate her again after feeling the step, feel the step again to see if it's changed. Come back to neutral. Go to the next segment. Here. I'm going to now extend into the segment, feel the step, rotate. Notice I'm not allowing my left arm to move. So that's the arm that's the stabilizing arm to the caudal spinous process. And I'll do this all the way down. Extend, feel the step, rotate, feel the step again. Come back to neutral, go to the next segment, extend, feel the step, rotate, feel the step again. Extend, feel the step, rotate, feel the step again. Here, L4 and L5, extend, feel the step, rotate, feel the step again. L5 on S1, extend, feel the step. This one's a little bit difficult to feel sometimes because the S1 can be rather small. Rotate, feel the step again. This same testing procedure can be performed to the other side. I'll again start out high, T10 on T11, extend, feel the step, rotate, feel the step again. And I'll work all the way down. looking for a discontinuity in the rotations all going the same direction from cranial to caudal. Now we're going to perform segmental rotation in a seated position, incorporating flexion and rotation. For this test, we ask the patient to cross their arms. I'm going to now rotate the patient towards me. It's easier to control. And in so doing, I need to palpate the contralateral side of the spinous processes. Because as she rotates, her spinous processes are deviating away from me. So I will once again position the table at a workable height for myself where I don't have to squat down too far, while maintaining her hips at 70 degrees of flexion. In this case, we used a box under her feet. I'm now going to grasp the rib cage, and in this case, place my testing thumb on the contralateral side of the spinous processes from where I'm standing. I'm now going to flex her into that segment. To get there, I simply curl her down until I feel the flexion in that segment. I want to avoid any side bending in the segment, and now without moving this arm, I'm going to use this hand to rotate her segment towards me. In order to perform the test, I'm going to stand next to the patient, grasp her rib cage, and place my thumb on the side opposite to where I'm standing, over on in this case, the left side of her T11 spinous process. I want my thumb tipped to feel the interspinous space. And now, what I'm going to do is, while avoiding a preposition of side bending, I'm going to flex her into that segment by allowing her to curl down, keeping her shoulders relatively over her hips until I feel flexion in that segment. And then, while maintaining stability in this arm, I'm going to rotate, use this hand to rotate her towards me. Now, before I start the rotation, I've got to feel the step relationship between the spinous processes. And then, when I rotate her to the point where I feel the beginning of rotation in T11, and at that point I stop and re-examine the step relationship. I come back to neutral. I now go to the next segment. Again, flex into the segment, avoid prepositioning of side bending, rotate in the segment, feel the step again, come back and relax. Go to the next segment, flex into the segment, avoid that preposition of side bending, rotate and feel it again. Notice I'm not allowing this arm to follow the rotation. Otherwise, I get way past the rotation in the segment. All right, I'll go to the next one. I go flex into the segment, rotate, feel the step again. Flex into the segment, feel the step, rotate, feel that step from the side again. All right, now I'm going to flex into the segment here. You have to curl the patient a little more because we're a little down a little further. Now I'm going to feel the step, rotate into the segment, feel the step again. Come back up, L4-5. It gets a little tougher to feel down in the lower segments. I'm going to flex her into the segment, feel the step, rotate her, feel the step again. Last one, L5-S1. Flex her into the segment, feel the step, rotate her, feel the step again. As with the testing and extension, we can perform the tests to the opposite direction as well. Here, I'm going to go flex into the segment, feel the step, rotate, feel it again, and so a little bit faster here. I'm doing it at every level. Good. Each time making sure that I don't allow, in this case, my right arm to move, thus providing stability to the caudal segment, like this. Got to get it to curl a little more to get that flexion L5S1.